Good afternoon. Thank you for staying so late because it is, of course, the last day, and I've been here for 3 days, and my mind is really boggling about all the things I've heard. So thank you very much. My name is Erik van der Zijden, and together with Erik Taubert, we are from Holland, and that is indeed the country that brought you TomTom and the new maps on the iOS 6. So sorry for that, but there's also something else happening in Holland, and our capital city is renamed into Amsterdam, and that is actually done by a guy who came here from Silicon Valley. So I studied medical biology, and that was some time ago, and I ended up in pharma for the last 17 years, and I figured out more or less the hard way that if you want to change the world, you should not do that in a corporation of about 60,000 people. So a year ago, I started together with 2 business partners, among others, Erik, our company, Synapse, and we focus on reinventing healthcare through mobile. And by doing so, we understand that mobile is really getting some traction into health. And we were this year in Doctors 2.0, and we presented some of our ideas, and we won the prize of eHealth Startup of the Year. So I would like to thank Denise and also Larry that we're very honored to be here to tell something about the unmentionables. There are a lot of conditions and a lot of diseases that people do not want to talk about because they are ashamed. And we feel that also for these conditions, technology should help. And Erik Taubert, he is a urologist, but he will tell himself. He, of course, faces these kind of people many times a day. So, Erik?
Thank you, Erik. All right, I would love to share some things with you that have been incentive to our initiative. And one of the things is that, if you call it unmentionable, for me it's my daily bread and butter, but incontinence is a huge problem. And you know, it's always been a problem that women tend to carry with them, and they would not share this. And obviously we are now in the middle of sharing and patients telling stories, and you know, we want to all have the better of it. So why did we focus on this incontinence problem? In the old days, there wasn't really a solution for incontinence. I mean, doctors could only help a little bit. We didn't have good surgery. There was a really big problem with the incontinence coming back, and patients didn't share their stories about this. If you see the difference between what happens on the internet now, is that even in incontinence for women, which, don't forget, over the age of 40 for women having had childbirth, can go up to over 50% in some way. This really cries for a good solution. Now, the other thing that we are going to mention later is incontinence for stool. Now, even that is something that I thought that wasn't really happening too much until we started a multidisciplinary team where we started to focus on pelvic problems, urinary incontinence, and I was really looking into fecal incontinence as well. And there is this 2007 study which is done in the States that showed that even 25% of females suffer in some way from fecal incontinence. Now, you do realize that these two conditions can be enormously socially isolating and have a great burden on your quality of life. Now, if you go to a doctor, the first thing you have to do is communicate your problem. And we all know how difficult that is. But in order for a doctor to be able to help in any way he can, he should know what is going on. And it's difficult to talk about these things. So one of the things that the guidelines always say in doing an inventory on incontinence problems is using this frequency volume chart you see here. And this is the way we've always been doing it. It's been used on pen and paper. And it's like, this is what we want to change, and this is what we want to make better by using the digital technologies that we have today. So seeing this problem and trying to interpret the data that we get on paper and also sharing it with patients and make it better to understand for patients, I turned to Eric, that later became my business partner, and we started thinking about a solution.
So I don't think I have to explain here that the mobile phone or any mobile device is the real personal computer that was promised to us in the 80s, which of course at that time was not really a personal computer. But the thing we have in our hand knows everything about us and can store all the information about us. So if we go back to these forms and look at the data that is on it, I mean, I'm fortunately not a patient, but if I look at it, I do not understand. And it's very important, and I think we've heard it many, many times in this conference, that patients do not understand data, they understand information. So, thinking about that, we said, okay, how do we then go from the manual input that is being done by these people, by the patients, to go to data? And a lot of apps, actually, mobile apps, they stop here. They say, okay, I have now created an app that will provide the manual input and then will change into data and have it in a very nice order. But then if you want to go further and you would like to make information out of it, it's very important that you use, in our case, infographics that patients also understand what's going on with them. Because if they have information, then the final step is that they have knowledge about their disease, knowledge about their condition, that they then can share with the healthcare professional or with other people. And in that respect, we created IP Voiding Diary. You see a few screenshots here. An IP Voiding Diary is an app. It's pretty simple, actually. It measures, it captures the volume you drink, so how many drinks you have on and on which time, and also the numbers of P's and the volume you have. And finally, as well, the urine incontinence, the incontinence that you can score very easily with also the pain and the urge. And that's one step, but then you have the data, and then we said, okay, now let's make a report that also the patients understand. And then, as I said, we use infographics to show here, did I drink enough, or did I pee sufficiently, or what happens to my incontinence? Another thing which is very important, and I think in the US, the FDA is still a bit vague about certification, is that in Europe, it's pretty clear whether you are an app or you are a medical device. And it appears that our app, because it gives some diagnostic information, is a medical device. So we are now in the process of having the CE marking for our application. And as you can see here, that is quite a lot of work. Coming from the pharma, I know what it is to create technical files, but I've never, expected that I would do this also for our apps. But it is important to make aware for the patients and also for the healthcare professional that there is a quality involved and that the data is secure and that there's some backup and things like that. And that will be for the CE marking. And what we then said is, how are we going to implement it in a hospital? And we figured that not everybody has iPhones or smartphones and things like that. So we created we designed iPodium, where we lend iPod Touches in the hospital to patients who do not own an iPhone or a smartphone. And they can fill it in and they can bring the iPod Touch back to the hospital to see the data, and then the specialist can look at it. Now, using the same framework, we of course also focusing on IP Voiding Diary version 2, where we're going to implement also some exercises and also having pad use, which is of course very important when you suffer from incontinence. Now, using the same framework for IP, there's another one which happens on the toilet, which Eric just talked about, and that is iPoo. And with iPoo, we're going to measure also the intake, and which is very important, is the fibers what go in, and also what goes out. And then it is important that patients are able to tell the story, what happens, because it's a very complicated matter. There are a lot of components involved in observation, and how to untangle that and how to make it a consistent story for the patient, also for the healthcare provider.
Okay, so I hope you can see the benefit in this. I think it will be clinically very helpful to have patients coming in with these kinds of data. It'll help in history taking, which you all know is one of the most important, it's actually the mainstay of diagnosis. We promise you to do some unmentionables. I'm very happy that we are in a hospital setting here, because this is one of the unmentionables that is very difficult to present. But one of the challenges of urologists is dealing with problems of the penis. Can I have the first slide, please? Now, we all know that it's supposed to be like this. We probably all know, or maybe a few of you know, that there is a condition which some people have. It's called Peyronie's disease. You may have recognized that some people have their fingers like this, or maybe walk a bit difficult, and it's because of there is a calcification plaque in the fibrous mass that you have in your hand or in your foot, or in the cases of patients with Peyronie's disease, it may be in the penis. And this is the result. Now, this very frustrating and sometimes painful disease, it usually is painful for about a year, is going to give you a lot of loss of quality of life, and not just for you, but also for your partner. The problem is that we cannot solve this disease. We cannot stop it. We will just have to let it ripen, and when the patient wants to, we can operate on it. Now, it's known that it's extremely difficult to operate these kinds of penises. There's a lot of psychological burden. The outcomes are really not very well, and the surgery is quite extensive. And one of the things is that it's extremely difficult to plan these kinds of surgeries, because you never really know what comes out. So you want to have a good surgery planning. So just in, let's say, the framework of unmentionables in the urology setting, we wanted to present you with a new app that we are now developing, and it's called Apperonie.
Well, the thing is that the iPad is a very powerful device, and for one of our apps for physiotherapy, we're working on 3D modeling, and we figured, so how could we use 3D modeling to help people with this condition? And so based on user, or let's say patient input, in this case pictures, we are able to pinpoint certain elements of this picture and create a 3D model, which will then help the specialist to do some surgery planning. But also very important is to explain to the patient what is actually going to happen during this surgery. And we believe that this is a really interesting example of how technology could not only benefit the doctor, but also in the doctor-patient communication about what is about to happen. Now, eventually, if we have all these apps, it's important that this data is set free in some way. And we haven't figured it out yet either. I mean, we've heard very nice stories about platforms but what will be the de facto standards of these kind of devices, and how you are able to set free this data to create information? Because one thing is for sure, if there's one thing that I take home back to Holland, is that, of course, patients would like to tell their story. And by providing mobile technology, so that this mobile technology, this mobile device is only a window to their story, that is very important that we achieve that. And creating these mobile technologies and creating these mobile platforms, I guess that's what we get out of bed every day in the morning. Thank you very much.
Thank you.